Social action has a long tradition, giving, volunteering, whether formal or informal. Today the emphasis is on transforming public services through networks, citizens working alongside trained professionals. And fueling the process is a growing cadre of social innovators and entrepreneurs, giving unstintingly their time, their resources and their expertise. This film highlights their achievements. Over the last 3 years, an ambitious volunteering programme has changed the face of London's King's College Hospital. Help in Hospitals is 21st century social action. Young and old, from every part of the community, supporting clinical care through acts of human kindness.
My role here as a volunteer is to encourage the children to take part in activities, to play with them, and to just generally take their mind off of the whole hospital setting so that they can somewhat feel at home. I can't make the pain go away as much as I want to. I'm there for support for the parents as well as the patients.
4 years ago we probably had about 200 volunteers. Today we've got 1,500. We have unanimous support among staff, and it's very noticeable that on the wards that have more volunteers we definitely get an improvement in the how we're doing surveys.
It's not only rewarding, but you gain so many skills, social skills, and it's confirmed my future plan of becoming a paediatric nurse. This is what I want to do.
I'm 100% sure that the costs of running this programme are far exceeded by the benefits of it. There's absolutely no reason why every hospital in the country couldn't do what we're doing here at King's.
The scale of volunteering at King's has made it a beacon for social action across the country, and the model's now moving into a second wave of hospitals. The same spirit is spreading rapidly into education too. The Access Project has built a team of corporate sector volunteers. They work intensively with disadvantaged students, helping improve their grades and then apply for top universities. A powerful response to a real and urgent problem: declining social mobility.
Before the Access Project, I knew that I wanted to go to university, but the top universities like Oxford and Cambridge always seemed intimidating. But after joining the Access Project, I gained the confidence and the grades through the help of my tutors to apply.
Unfortunately, if you go to a school in an area of disadvantage, your chances of going on to a highly selective university are tiny, and the people who get in are the exception. They are the one student every 5 years who manages to buck the trend. At the start of the year, we estimated that we'd be able to support about 63 students. At the moment, we're delighted we've actually got 91 who've received offers to Ross Group universities.
Life in Oxford is absolutely fantastic, just a really, really inspiring place to learn. I am here because of the Access Project. It equips people who come from working class families to go on and, get the job that they want to do.
We want to be in over 100 schools working with about 6,000 kids by 2020. The last 20 years have seen an amazing story in terms of the democratisation of university participation. This I see as the last element of cracking the nut of why do less affluent kids not go to the top universities.
The Access Project is having a profound effect on a relatively small number of people. It goes deep and narrow, that's its power. But are there also ways to have a broader impact and reach bigger student numbers? Code Club, teaching the next generation the skills for a digital age.
Code Club is a group of volunteers that come into schools to teach 9 to 11-year-olds basic programming skills that they can then choose to go into it in further education.
No barriers to scaling here, 2,300 clubs already created. And the programme's inexpensive, it simply matches schools with volunteers.
I definitely think that this project should be rolled out nationally because children seem to enjoy it and they get basic skills that they can transfer amongst many other fields later on in their life.
Well, when I look at Code Club, I think it is extremely powerful. Largely because it is a new aspect of the curriculum that we have to develop in schools. So bringing in people who have absolutely cutting-edge knowledge in terms of coding is essential for motivating the young people, but also potentially helping to support and train our teachers.
Code Club, like the Access Project, faces a triple challenge: scalability, affordability, and impact you can evidence. Both projects have further to go before declaring victory, but the signs are good, creating the potential for transformation for the sector as a whole.
When I look ahead 5 years, I think the role of the head as a commissioner of social action opportunities within schools is absolutely vital, but it shouldn't just stay with the head teacher. It really is to permeate throughout the whole organisation so it can be a real catalyst for change.
So in education, social action could significantly enrich provision. And as in education, so too in health.
Social action can be transformative and impactful in social care. We are living in a time when needs are increasing significantly as resources are reducing.
1 in 3 people over the age of 65 will develop dementia. Dementia Friends is about ensuring that people in their community understand what it means to have dementia and the small ways that they can help. We've developed a training programme for volunteers who become Dementia Friends champions. They will then go and book a Dementia Friends information session and encourage people to come and hear what they've got to say and how they can help.
Our goal in Dementia Friends is ultimately to create dementia-friendly communities across the whole of our society, and we're hoping to do that by creating 1 million Dementia Friends by 2015.
It's amazing what social action will do, and we've reached so many people so far, and long may that continue. You know, we want more champions who are creating more friends to make a difference for people with dementia.
Dementia Friends is designed for mass impact. It aims to change how a country thinks about dementia. But providing sustained dementia care requires a different complementary initiative to reach at least a proportion of people living with dementia. And if you look across social care as a whole, there is a network-based model that's making a deep difference to people's lives.
Shared Lives Plus is a fantastic initiative which enables people to throw open their doors to provide care for people, enhancing their dignity, choice and control in ordinary community settings.
We've got 3 ladies that live with us. One lady is 32 and she has Down syndrome. Another lady she's 19.
She was living with less than positive influences in her life, and now challenging behaviour is very much reduced.
The third young lady was somebody who actively sought out this placement, and she wanted to come and live in this kind of way.
Well, since the girls have lived here, they've taken an interest in their health. They show less signs of stress.
They've acquired friends, they're invited to parties, they have a social life, a real social life, same as anybody else.
They're independent but not alone.
I think a lot of people at the world, like Grandma Norna, will love to be in shared lives, love to share their lives with somebody.
It feels like in our family.
We are one big family, and that's why it works so well.
We not only care and support the 3 ladies, but we also care about them as well. And we also love them as part of our family.
Shared Lives Plus is scalable, affordable and impactful. It's launched 120 schemes across the country, and it calculates that if every scheme were as good as the best, it would triple its reach and save £150 million a year. So, 5 breakthrough projects across 2 very challenging sectors. Is this a platform for wider change?
We've got the opportunity for some amazing transformation with social action. It's another immense resource for this country, really, looking at what's the role and the contribution that's different from the role that a teacher can play, or a doctor can play, or a nurse can play in those services.
It is a time for innovation. It is a time for not necessarily just compliance, but trying something new and working alongside people to see if we're actually getting there and what the lessons learned are.
This is quite revolutionary. At King's we really believe we have connected with the population that we serve. One of our values is making a difference to our local communities.
Commissioners can secure that legacy by making sure that they're thinking about the role of voluntary and informal effort in contributing to meeting people's needs in their local communities. So these things make a tremendous difference, perhaps not just to people's immediate care needs, but also the quality of people's lives. Social action is absolutely critical to the future of social care in this country.
These projects are already changing lives, but they're still prototypes, and it's the work of the next phase to attribute their impact securely to practices that are evidenced and understood. In the long term, the goal is to embed social action across the public services, to spread these remarkable and life-enhancing changes into every school, every hospital, and every community, to make social action part of everyday life.